This is a Lodi taping technique to support the arch of the foot. Essentially what's going on here is that um, this person is excessively pronating, navicular drop greater than 10 millimeters, and as a result it's causing medial foot pain and medial knee pain when running long distances. So essentially what we're doing is giving some support to the arch and hoping to decrease that pain a little bit. So the first application of tape that I used here is along the bottom of the foot. I used a U-strip and I basically followed the contour of the outside of the foot from the fifth med head around to the first, and then I secured tape across the bottom of the foot, basically reinforcing the plantar fascia. So the next aspect of it is going to be the arch support. So I also applied an anchor, as you can see here, along the tibia. So this is the modified version of this. You want to keep your patient in a dorsiflex position for this. So what I'm going to do is we're going to start medially and go laterally. So do here. So we'll start on the medial aspect of the ankle, above the medial malleolus. And then we're going to come down across the dorsum of the foot, underneath the arch, and then up. Pull up on the arch towards the medial malleoli. Okay? We're going to apply maybe 3, 4, sometimes even 5 strips, depending on how much support your patient needs. Pulling up here. So essentially, we are acting as the tibialis posterior muscle, right? Which is the main supporter of the arch of the foot. So we'll do 3 applications. As you can tell, I wasn't an athletic trainer. My taping skills are subpar at best. Okay. And then the last step is called the calcaneal sling. So this time we're going to go lateral to medial. And what we're going to do here is basically supply a sling for the calcaneus. So again, improving arch support. So here I'll start above the lateral malleolus on my tape. I'm going to course just below the medial malleoli. Okay, we're going to go down on the midfoot, and then we're going to go on the postolateral aspect of the calcaneus and up towards the lateral malleolus. Didn't have quite enough tape there, so I'll make sure to make my next one longer. Again, lateral to medial, under the arch, postolateral aspect of the calcaneus. You want to try to not get wrinkles in the tape, obviously, because the patient's going to be putting their foot in a shoe, and that might disrupt their gait pattern. Okay, and the last step will be to reinforce that anchor at the top around the tibia. Last thing I'll do is have the patient stand in a weight-bearing position, and I will apply tape across the dorsum of the foot to secure the plantar fascia component of it. And then I'll just make sure that we have good circulation by checking the toes and make sure that we're getting blood flow back in each toe within at least 2 seconds. And then the last thing to make sure that this is working is I'll have my patient do their normal routine, which typically for her is going to be running, so I'll have her go for her run, and we'll see if that supports that arch, decreases medial foot pain, and decreases the knee pain.